Thank you for joining America's Roundtable. We're delighted to have guests with us from Orlando, Florida. We have an entrepreneur and business leader, Mr. Harris Rosen, who is the president and CEO of Rosen Hotel and Resorts, and an executive with the company, Kenneth Aldridge.
Hello, Mr. Rosen. Your primary business is in hotel industry, and we visited your healthcare facility, your clinic, in March, and we're very impressed with the business model and the vision that you have. Can you share with us the details?
About 20 years ago, we decided that the way things were going was not satisfactory. We did not believe that the third-party healthcare provider really honestly had our best interest at heart. What made the decision for us to attempt a whole new paradigm was when we were told our premiums would go up, despite the fact that when we analyzed at the end of the year the situation, it was abundantly clear that the insurance carrier had spent far less than what the premiums were. And so we expected at the end of the year to receive some very good news. Instead of good news, we received some very bad news. Premiums would increase rather dramatically because the group we were in had a very bad year. Well, we never realized they had put us in a group. And B, we had no control over the group. And so we said, that's not fair. You didn't tell us about a group. We have no control over the group. And now, because the group had a bad year, we're going to have to suffer the consequences. And they were completely disinterested in what we were saying. We decided to convert that space into a primary care facility, to hire our own primary care doctor and the staff, and to get into a business we knew virtually nothing about. Back then, we had perhaps 500 to 1,000 covered lives, and we believed that we had a chance to make this rather radical departure successful.
How is this Supreme Court ruling going to affect your model of providing the health care for your employees?
About a year ago, the penalty for employers who chose not to provide health insurance for their associates was going to be about $700 per covered life. At $700 per covered life, to completely ignore health insurance for one's employees was very, very attractive. Because back then, the average cost per covered life in the United States for health care was probably in the $7,000 to $8,000 range. So as an employer, if you had associates who were receiving health insurance, you were probably somewhere in the $6,000, $7,000, or $8,000 range. Paying a $700 penalty to the government was extraordinarily attractive. It may have been one of the dumbest things that the government has ever done, or it could have been one of the more Machiavellian initiatives to wean people away from the private sector into the government exchanges. We protested what we thought was crazy, and we actually did receive some national attention. We were on several television shows. And I'm sure it wasn't a result of us, but a result of others who also felt the same way. The penalty was increased to $2,000, which is where it stands today, which is still a far cry from what the national averages are, but not nearly as silly as $700. Our cost per covered life, the company's expenditure, not what our associates are paying, but our own expenditure is in the neighborhood of $3,000 and has been close to that for the last several years. And so we would save about $1,000 times about 4,500 covered lives, and so we would save about $4.5 million. But that is not at all tempting for us. We love our medical facility. It's brand new. We love the staff. We have wonderful primary care docs, wonderful nurse practitioners, wonderful associates in our radiology, podiatry, nutrition units, pharmaceutical units. So we're delighted with what we have, and we will retain it. We love the fact that we're able to provide health insurance for our associates. We think they enjoy working for a company that cares enough about them to provide insurance. If you work for Rosen and you're in the hospital, you pay $500 max first visit. You pay $500 max second visit. After that, you don't pay. We think that's a very, very attractive policy to have. And it is one of the primary reasons that our turnover is amongst the lowest in the industry, and why we have such loyal and I think enthusiastic associates.
With us adding more demand onto our healthcare society without increasing the supply, such as general practitioners, people are going to have long waits to get in to see their primary care doctors, which is only going to drive people back to the emergency room. At least our healthcare plan, we're providing the healthcare for our associates to continue to keep them at optimal health by providing the access to healthcare, not the ER. The ER is not access. And unfortunately, some of us believe that ER is the access, not here at Rosen Hotels. Rosen Hotels, we try and remove the barriers, improve access to healthcare by things such as Mr. Rosen drives his associates from the hotel to our medical center while they're on the clock. That removes barriers to access. This increase in demand with a reduction in the supply, we are going to have some serious issues with primary care and people accessing the preventative and primary care, which is supposed to be the foundation of healthcare.
This is a very interesting point because with hospital owners, the business model is such that you practically, if you spend lots of funding on preventative, you're in the future, you're reducing your revenue because obviously less people are going to look for the healthcare at your facility. But with your business model, it really perfectly fits with your primary business.
About 20 years ago, we created our own little medical facility and this relatively new concept. We did it because we weren't happy with what was available. We did it because we really care for and love our associates. We did it because we want them to be healthy. We emphasize laser-like, neurotically, on wellness and health. The United States of America doesn't have a health care system. We have a sick care system. We've created a health care system. And what's so amazing is that we did it for all the right reasons, and we've been blessed along the way. Because we've saved over the last 20 years, if you compare our cost per covered life with the national cost per covered life, we estimate our savings to be somewhere in the $220 to $225 million range, which is enormous, particularly for a small company. If the United States of America, if all of the businesses, public sector, private sector, academia, military, if they all replicated our template, emphasis on wellness, no smoking, emphasis on weight reduction, emphasis on lower cholesterol and watching one that was diabetic. If everyone did that and everyone had wonderful results as we have had, the United States of America would save over $1 trillion in health care, and the government would have no involvement whatsoever other than Medicare and Medicaid. And if that were handed over to the states, we'd be in a lot better shape.
What is your message to the private sector? What is your message to entrepreneurs and business leaders who are trying to find private sector solutions?
Don't be afraid. And come to us. We've been doing it for 20 years. We're happy to sit down with anyone and lead them through the process. We're happy to show them our medical center. We just had Congressman Webster here the other day, who was absolutely amazed at what we're doing. We had Marco Rubio's, the chief of staff, visit with us. We've had the current governor, Governor Scott, visit with us. What it would take probably is around 1,000 covered lives to create your own medical facility. But you know what? If you have a company with 50 or 100 people, walk down the street, walk in your neighborhood, go to the Chamber of Commerce, and pool your resources. Get 800, 900, 1,000, 2,000 people from various businesses. There are so many storefronts that are available. Rent a storefront. Primary care docs love to get out of the mess they're in now, worrying about rent, worrying about staffing, worrying about malpractice, worrying about all of the things they have to. They want to do what they love doing more than anything, and that's practicing medicine. Our primary care docs love working for us. Why? They don't have to worry about any of that extraneous stuff. All they worry about is taking care of their family members, making sure they're healthy, making sure that they stay healthy. So it's a wonderful asset for a private sector. Our turnover is the lowest in the industry by far. It's not easy because good things in life are seldom easy. You have to stay on top of it. You have to make sure that you're doing things correctly, but it's absolutely doable. The savings are enormous, and you create a whole new bond with your associate.
Thank you so much for sharing this encouraging message with us.
Mr. Rosen, Mr. Aldridge, I just am amazed when we visited your facility a couple of months ago. It was great to be able to meet your staff members. I was able to visit individuals that were working on reducing their weight, working on making sure they had their cholesterol in check. And you certainly emphasized the best that we have in the entrepreneurial spirit. And you truly exemplify what we need most now is private sector solutions, private sector initiatives, rather than depending upon big government to solve our problem. Thank you so much for joining us on America's Roundtable. We look forward to sharing your mission and what you're doing with others across America, and hope that individuals will join us in looking at solutions. And that's exactly what we're doing at America's Roundtable and throughout the country. Thank you very much indeed, Mr. Rosen.
Thank you, sir.